Hello guys, how are you all? I hope you have revised yesterday's notes, right? Have you revised yesterday's notes, guys? Yeah, obviously I did not send you the PDF yesterday, right? I did not send you the PDF yesterday. Actually, my plan was so even after completing today's lecture, right? And one more class is there. So after that, completely the upper limb notes, I'll be sending it to you in the Telegram group because you will be confused it because there will be number of notes of different faculties that will be coming in the Telegram group. So it will be really difficult for you. So at a time I'll send one PDF. Okay. So good evening Kishore. Good evening Cricket. Kamran. Good evening Kamran. Arshad Ali. Sure Arshad. I'll send you the notes. Hi Bhagyasri. Hi. Hello. Bruce Wayne. Hi Bruce. Good evening. Suhaib Ahmad. Good evening Suhaib. Piyush Sharma. Hi Piyush. Love Kumar. Kamran, I'm fine. Kamran, thank you so much. How are you? Hi Pankaj. क्रिकेट क्रिकेट माइक्रो का लेक्चर बहुत बहुत जल्दी लूंगा मैं, ठीक है. Good evening Joshna, good evening all of you. So let's start guys. Okay, we have little more topics to discuss today. Okay, so again I'm telling you one very important thing is that take a pen and paper, sit down and write whatever I'm teaching you, and from your side I want 100% response on whatever I'm asking. Okay, but from my side today, today the topics will be so interesting. I'll be teaching you the muscles of upper limb, the complete muscles of upper limb I'll be teaching you. Okay, so I know muscles of upper limb are really difficult. I will try to teach as easy as possible. Okay, but I want your full attention for you to understand this lecture. So if you are okay with this, then let's start guys. Are you all okay? Yes, Malar Viji, we will even discuss the nerves as well. Along with the muscles, we'll discuss the nerves obviously. Right. So let's get started, guys. In the yesterday's class, we have discussed about the mammary gland, right? So one very important thing I told you about mammary gland is that mammary gland is a modified sweat gland of apocrine activity. So this thing, I've already told you that mammary gland all the way it extends from second to the sixth rib, right? And this is the mammary gland. We will divide Tanishka. Head and neck lectures are coming subsequently after the upper limb and all. Okay. Saif Ali, thank you so much. I'm fine. Right. So mammary gland is divided into four quadrants. From the exterior lecture itself, you can find it. I'm just brushing it up. Okay. It is divided into four quadrants. So upper there are two quadrants, lower there are two quadrants. This yellow color shade, whatever is there, this quadrant, this is the most common quadrant that is prone to breast cancers. Okay, mostly breast cancers develop in this region. Okay, why I will tell you in today's lecture. Okay, and the muscles, you know that we discussed yesterday only pectoralis, major, serratus anterior and external oblique, right? So where did we stop yesterday? We actually stopped regarding the lymph blood supply. Right? We have discussed even the blood supply. We have stopped near the lymphatic system. Now I don't want you to comment, just concentrate on whatever I'm teaching you. Okay, look here. When it comes to the lymphatic system, when it comes to the lymphatics, when it comes to the lymphatics, in the breast region, we have got two types of lymphatics. One is called superficial, another one is called deep. Okay, so we have got two different types of lymph vessels. What are those two different types? We have got superficial, we have got deep lymph vessels. Okay, superficial as well as deep lymph vessels. Now let us see within the breast what are the different types of lymph nodes that are located. This is very important. Yesterday itself I told you how important is it. Okay, and one more thing is that today we shall also be doing some MCQs as well. Okay, right. Look here now. The lymph nodes on the breast, guys. Look here. Here exactly, which you can see from the camera here, right in front of me. These lymph nodes here are called as anterior lymph nodes. Okay, because they are anterior to you. Back of that will be posterior. Obviously, this is anterior. Then this is posterior. Okay, then what is this one called as? This is away from my body. So if there are any lymph nodes here, these are called as lateral lymph nodes, isn't it? So look here, what I'm trying to tell you is that here we have got anterior lymph nodes. These three lymph nodes are anterior. Just back of that, here we have got posterior group of lymph nodes. Okay, and away from the body, it means here we have got lateral group of lymph nodes. Okay, so what are the group of lymph nodes? A, B, C, right? A stands for anterior group of lymph nodes, B stands for posterior group of lymph nodes, C stands for lateral group of lymph nodes or lateral lymph nodes. Okay, now all of you look here, all these lymph nodes, if I'm drawing it like this, all of these lymph nodes are pointing upwards, right? They're pointing upwards, they're looking at some point there. So this is the point here, right? So why I'm telling you this, because here also you have got a lymph node which is exactly in the center, that is called as central lymph node. Okay, that is called as central lymph node. Central lymph node. Are you all understanding it? Dr. Bendick, thank you so much. I'm fine, Dr. Bendick. I'll tell you about sentinel lymph node later on. Okay, I'll tell you about that. Next important thing is that in the apex, we have got a lymph node like this that is completely on the top, apex. So you call this as apical lymph node. This is called as apical lymph node. Okay, so all these lymph nodes, anterior lymph node, posterior lymph node, lateral lymph node, central lymph node and apical lymph node, all these 5 lymph nodes, which area are they located, guys? They are located in the axillary region. So that is the reason why all these lymph nodes are called as axillary lymph nodes. So they're gonna ask you a definite question on this. What are the axillary lymph nodes? All of the following are the axillary lymph nodes except, so they might give you one of this and skip one of them. Okay, next important thing is that you even have a lymph node, one above the clavicle, one below the clavicle. So if there is a lymph node above the clavicle, you call it as supraclavicular. If there is a lymph node below the clavicle, you call it as infraclavicular. So we even have supraclavicular, we even have infraclavicular, right? Next lymph node is that we have got one lymph node here on the deltoid region, right? So exactly here on the deltoid region we have got a lymph node. This is called as deltoid lymph node. What is this lymph node called? This is called as deltoid lymph node. Okay, next important thing, yes Shoaib, PDF will be available, I want you to concentrate here. Next important thing is that you have got a lymph node on the inner sides of the mammary gland. This is the mammary gland. On the inner side of the mammary gland, exactly here you have got a lymph node, right? On the inner side of the mammary gland, here you have got a group of lymph nodes. Even on the opposite side also the same thing, right? On the inner side you have got a lymph node. So these are called as internal mammary nodes. What are these called? These are called as internal mammary nodes. These are called internal mammary nodes. And finally, we are left over with only 2 lymph nodes. Very good, Bruce. We are left over with only 2 lymph nodes. One lymph node is located over here, right? That is below the diaphragm. Another lymph node is located here. So this lymph node which is located on the back here, right? This is called as posterior intercostal lymph node, right? This lymph node is called as posterior intercostal lymph node, and which is located under the diaphragm. Under the diaphragm, this is called as subdiaphragmatic lymph node. Subdiaphragmatic lymph node. Subdiaphragmatic lymph node. Okay, all of you clear with this so far, right? And just remember one last point, along with subdiaphragmatic, there is also one more lymph node here that is located below the peritoneum. You know, you have got parietal and visceral peritoneum. Deep inside, below the peritoneum, you have got this lymph node. This is called as subperitoneal lymph node. So it is very, very, very easy to remember, guys. Subperitoneal, subdiaphragmatic, they are below the diaphragm. Posterior intercostal, and when it comes to axillary, we have got anterior, we have got posterior, we have got lateral. All of them are looking towards central. Okay, and obviously here we have got apical. After that, above clavicle one, below clavicle one. In the deltoid one, that's it, finish. We are done with the lymph nodes. Clear? Now I'll be telling you how these lymph nodes will drain. Okay, but before that, one very important thing is that yesterday class I told you that this center part, this center region is called as nipple. The center region is called as nipple. Surrounding the nipple, you have got what? This region surrounding the nipple, which is hyperpigmented. This is called as areola. I told you this. Now the same picture I'm showing it to you here, right? You see, center you call it as a nipple. Surrounding the nipple, all this area is called as areola. Now in this areola, you can see some plexus over there. You can see some plexus in the areola. So this plexus in the areola is called as subareolar plexus. Subareolar plexus of SAPI. Very important, guys. I want you to remember it at any cost. This is called as subareolar plexus of SAPI. What is this subareolar plexus of SAPI is doing? It is collecting all the lymph, whatever is located in the nipple region, whatever is located in the breast region, whatever is located in that subareolar region or areola, all that lymph is collected, and that lymph goes all the way and it drains into these group of lymph nodes called as axillary group of lymph nodes. I told you what are axillary group of lymph nodes, right? So they are draining into axillary lymph nodes. Clear? So the only question which they're going to ask you is that subareolar plexus of SAP, it drains into which lymph nodes? It drains into axillary lymph nodes. Guys, still here, are you clear? Before I progress to the next one, be fast, guys, be fast. Are you all clear, sir? Fine, fine. Bruce Wayne, fine, very good. Right, my main focus is on first and third year students, right? So if there are any first and third year students over here, I'm asking you that are you understanding this thing? Yeah, very good. So I want first and third years to comment. Very good, fine, nice. Now let us go on to the same thing. So these are the lymph nodes, you know, right? See, here we have got internal mammary lymph nodes, supraclavicular lymph nodes, infraclavicular lymph nodes. Let us say this is deltoid lymph node, or sorry, central lymph node, right? We have got lateral, we have got anterior, we have got posterior. This is central, this is deltoid, right? So all these lymph nodes are here itself. Now, the important thing all of you have to know. Now, open your 2 ears and listen to what I'm telling here, guys. Very high yield point. If I am dividing the breast into 4 quadrants, if I'm dividing the breast into 4 quadrants, look what is happening. The upper lateral quadrant, right? So we have got lower quadrants, upper quadrants. In upper quadrants, this is the medial quadrant, this is the lateral quadrant, right? This is the medial quadrant, this is the lateral quadrant. So in the upper lateral quadrant, look here very carefully. All the lymph from the upper lateral quadrant drains into this group of lymph node. What is this? The axillary group of lymph nodes like this. Okay. First it is draining into anterior. It is also draining into posterior. And next what is happening? The posterior drains into lateral. And all these three, anterior, posterior, lateral. Let me write it down. Anterior, posterior, lateral. All of these, they drain into the central group of lymph nodes. Okay, central group of lymph nodes. Now, all the lymph in the central group of lymph nodes, it drains into the deltoid group of lymph node. From the deltoid group of lymph node, it drains into the apical group of lymph node. From the apical group of lymph node, it drains into the supraclavicular lymph node. From the supraclavicular lymph node, it drains into your venous system, your veins, your subclavian vein and all. Clear so far? Have you understood, guys? From the upper lateral quadrant, how it is going? So, can I tell you one thing, that upper lateral quadrant is covering all your axillary lymph nodes? First point, upper lateral quadrant covers your axillary lymph nodes. Axillary lymph nodes. Guys, attendance marked. Okay, fine. I want you to answer here. Upper lateral. What is this? Upper lateral quadrant. It drains completely into the axillary group of lymph nodes. Okay. Second important thing. Second important thing is that look here very carefully. Coming to the medial quadrants, the medial upper, medial lower quadrant. Both these medial quadrants, they drain into the internal mammary lymph nodes. Where do they drain? Internal mammary lymph nodes. So can I write it like this? The median quadrants, both of them, they drain into internal mammary lymph nodes. Clear? So two things you have to keep clear. Two things you have to keep clear. The lateral quadrants drain into axillary. The medial quadrants drain into internal mammary. Okay. Then what about these two lower quadrants here? Very, very simple. I already told you that you even have a plexus here, right? What is this? Subperitoneal lymph nodes. This is also called as subperitoneal lymph nodes or subperitoneal lymph plexus. Lymph plexus, you can also call like this. So occasionally, sometimes, or let us say 3 to 4% of the time, the lower quadrant will drain into this subperitoneal lymph plexus. The lower quadrant will drain into subperitoneal. Okay. So from this, I will tell you one very important thing, that 75% of lymph, 75% of lymph of your breast is drained into axillary lymph nodes. Is drained into axillary lymph nodes. Next, 20% of lymph is drained into internal mammary lymph nodes. Internal mammary lymph nodes. Just 5% of that, 5% of the lymph will drain into your subperitoneal lymph plexus. Subperitoneal lymph plexus. Now, have you understood these three statements? To teach you these three statements, I've explained all these things. So this is very, very, very important statement. Very, very, very important. Okay? Very, very, very important. Yes, Shantanu, you can happily start with these lectures. Okay? No need to worry. Hi, Med Booster. So all of you understood, guys? All of you have understood whatever I've taught now? Yeah? Fine. Next important thing. Next important thing is that, let me take up this box all the way down. Yes, look here now. Right. So as I told you, 75% of your lymph is drained into axillary lymph nodes, right? And this 75% of the lymph is coming from which part? It is coming from this part over here, right? It is coming from this yellow color part, whatever I am writing it. And mostly which part here? Mostly the upper lateral quadrant. So can I tell upper lateral quadrant, as it is draining lot and lot of lymph, so can I tell that cancer cells from the upper lateral quadrant can very easily enter into the axillary lymph nodes, right? And most commonly the breast cancers also develop in the upper lateral quadrant. You know, cancers travel through lymph. Cancers also travel through your blood hematogenous pathway and lymphadenous pathway. So most lymph is there. So obviously cancers will develop in the upper lateral quadrant, right? 60% of the cancers develop in your upper lateral quadrant. Keep this thing in mind. Okay, right. Next important thing is that, whenever a patient has got a breast cancer, the first important point to remember is that the patient will complain, doctor, I'm feeling some kind of hard lump which is in my breast. The patient feels a hard lump like thing in the breast, and you have to ask whether it is painful. The patient will tell, no, it is painless, no pain. And when you examine the breast, look at the breast, guys, look at the nipple. In these patients, what will happen is that the nipple is pulled back, right? The nipple is pulled inside, it is retracted backwards. As you can see the nipple, this kind of nipple is called as inverted nipple. Normally nipple is like this, now it is inverted inside, right? So this kind of nipple is called as inverted nipple. So regarding the breast cancer, what kind of questions they can ask? One question they can ask you for sure is that yesterday class I have told you that you have got a lobule like this, right? This lobule will drain into something called as sinus. This is called as lactiferous sinus, and lactiferous sinus will in turn drain into this duct called as lactiferous duct, isn't it? Obviously guys, within lactiferous sinus or lactiferous duct you will have epithelial cells. So let us say within this lactiferous duct you have, right guys? I'm sorry, so there was a little delay. So all of you can look at the screen right now. Yeah, now visible, right? Yeah. So remember this one statement, guys. Remember this one statement, that how does, I mean, from where does this breast cancer arise basically? So at this picture itself, I'm writing it. Green boy. Breast cancer arises from the epithelial cells of this lactiferous duct. Epithelial cells of lactiferous duct. Okay. Now, next important thing I want to tell you about the breast, and we shall close this discussion, guys. Let us say that this is the breast, this is the nipple, right? Now, all of you know that within the mammary gland, within the breast, you have got a lot of veins. Let us say there are lots of veins like this, right? So, there are lots of veins. There is a very intense venous network like this. Okay. Now, what I'm trying to tell you is that, for example, all of you concentrate now. For example, if there is a cancer that is on one end of the vessel as well as on the other end of the vessel, there is a cancer on one end as well as the other end of the vessel, then what will happen? What will happen is that whatever fluid which is present within the veins, right? So will this fluid move forward or backward? It cannot move anywhere, so it will stuck there, right? It will be there itself. And what will happen? What will happen is that, look here, the quantity of the fluid increases. As the quantity of the fluid increases within the vein also will swell up. When the vein will swell up, what will happen? Look here, when the vein is swelling up, there are gaps in between the veins. So when there are gaps, what is going to happen is that all the fluid is going to leak out. All the fluid is going to leak out. So there will be a lot of fluid that will be deposited within your mammary gland. So when there is a lot of fluid that will be deposited within the mammary gland will swell, right? Now when the mammary gland will swell, this is how the mammary gland looks. Look at the mammary gland here. I mean, this is an orange, obviously. This is an orange. This is the nipple, and look at this mammary gland here. So I am showing you the real picture. This is a picture of an orange, but look at the real picture. The real picture also looks like an orange, right? Now, what is this condition called as, guys? This condition where the entire breast, because of excess amount of fluid, when it turns to orange, right, orange like appearance, this is called as Pudy orange syndrome. Pudy orange syndrome. Very good, Shreya Jajaria, excellent. This is called as Pudy orange syndrome. And yesterday I have explained you regarding the nipple. Nipple is in which intercostal space, guys? Can anyone tell? Which intercostal space is the nipple? Very good. Nipple is in the fourth intercostal space. Excellent. Very good. Now we are done discussing the breast. Now let us discuss the axilla, guys. Okay. Now all of you are ready? Yeah. Have you understood the breast topic, guys? Completely? Very good, Shubham. Very good, Adil, Medico Explorer. Very good. Right. Fine. So let us start. Now, when it comes to axilla, after the axilla, I will be starting and discussing the muscles of your upper limb. Okay. Now, when it comes to the axilla, first of all, axilla is a pyramidal shape. Axilla is actually like this. Look here now, all of you. Axilla is somewhat like this. Okay. So, this is the shape of axilla basically. Axilla is a pyramidal shape. Okay. Axilla is a pyramidal shape structure. Axilla is a pyramidal shape structure. And where is this axilla located? This axilla is located in between the upper arm as well as the chest. All of you look here. This is the chest. This is the chest and this is the upper arm. Between the chest as well as the upper arm, whatever area you can see here, right? So this is called as your axilla. Okay. Now in this axilla, look here. This region is called as the apex of the axilla. As I'm going down, the boundaries are getting broader and broader and broader. So this will be the base. This will be the apex. This will be the base of the axilla. Okay. This is the only thing you need to remember for now. Now, when I'm talking about the apex of the axilla, how can I know the borders of axilla? I will only know the borders of axilla when I put a camera on the top. When I put a camera on the top like this, only then I will know the borders of axilla. So when I'm putting a camera on the top, how does the axilla look? All of you look here, pay attention. This is my clavicle. All of you pay attention, guys, because these borders are really difficult, right? So stop commenting, look at this. This is my clavicle. Exactly back of my clavicle, what do I have? Scapula. And what is here exactly? What is here? Here is the first rib. This is my clavicle. Back I have scapula. This is my first rib. The same things I'm drawing it right now. Look here. This is the clavicle. Back I have what? Scapula. Look here. This is the scapula on the back. And we have got the first rib like this. Okay. So this will be your scapula. This is your clavicle. And this is the first rib. So this is the picture which I'm looking from the top, right? So clavicle is anterior. So obviously this is the anterior side. Where is scapula? Posterior. So obviously this will be the posterior side. And where is my first rib? Medially, right? So this will be the medial side. So this is the question which was asked in 2016 FMGE, guys. 2016 FMGE, they asked what forms the borders of the apex of the axilla. The apex of the axilla are formed by anteriorly clavicle, medially the first rib, posteriorly scapula. Did you understood? Right? Have you understood, guys? Yes, Revant Reddy is telling it is called as cervico-axillary canal. Very good, Revant. It is also called as cervico-axillary canal. It is called as cervico-axillary canal. Very good, very good. Now, what I'm doing is that I'm going little bit below now. Okay, we have done discussing the upper part. Now I'm going to the lower part. Now, in the lower part also, yeah. By the way, I have got this picture as well. Look here, guys. This is my sternum. Okay. Anteriorly, I have got what? Clavicle. Posteriorly, I have got what? Scapula. And medially, I have got what? First rib. So, this cavity or the canal which I can see here, this is called a cervicoaxillary canal or the apex of the this thing, the axilla. Okay. Now, look here. Another important thing. Another important thing is that I'm going little bit below now. Now this is very important and I'm telling you, if they will ask you a question on the upper limb, there will definitely be a question from axilla as well. Okay. So now we shall be discussing the axilla and its contents. Axilla and its contents as well as the boundaries also. Okay. Now, I to avoid confusion, just concentrate on me. Look here. What are the walls of axilla? Now, I am putting my hand like this. Now, when I am putting my hand like this, first thing, I have humerus. Where is humerus? Laterally located. Medially, what do I have? Laterally, humerus I have. Then medially, what do I have? Medially, I have got my ribs. Laterally, I have humerus. Medially, I have got my ribs. Posteriorly, what do I have? Scapula. Humerus, ribs, scapula. Clear? Now look here. What did I tell you? Laterally, what do I have? Laterally, I have humerus. This is the humerus. Okay. This is the humerus that is located laterally like this. Medially, what do I have? Ribs. I have got my rib like this. Medially. Posteriorly, what do I have got? I have got scapula. Let us say posteriorly, I have got my scapula like this. Clear? So now, very important thing. After writing the boundaries, the second important thing I'm doing is that anteriorly, what do I have? What is this muscle anteriorly? Anyone? Be fast, guys. Anteriorly, I have got my, come on. Very good. Pectoralis major. Anteriorly, very good. Birappa, Revant Reddy, excellent. Anteriorly, I have got pectoralis major. So look here. Anteriorly, I'm drawing pectoralis major. If I remove pectoralis major, inside what will be there? Pectoralis minor. So I'm drawing pectoralis minor also. Okay. Next, coming to the humerus, within this humerus, we can see three things. What are these three things? This is called as bicipital groove. Okay. Next, we have got the lateral lip here. We have got the medial lip here. Now, you tell me, from the bicipital groove, I am drawing a muscle all the way like this. What can be this muscle, guys, from the bicipital groove? Yes. What is this muscle which I am drawing from the bicipital groove? Not biceps. Very good. Latissimus dorsi. Latissimus dorsi is the muscle which is arising from the bicipital groove, right? Now, from the lateral lip, what is the muscle that is emerging from the lateral lip, guys? Yes, what is this muscle that is coming out of the lateral lip like this? Very good. This is teres major muscle, right? This is actually the medial lip, okay? This is actually the medial lip. So, this will be your lateral lip, right? This will be your medial lip. Medial lip. So from the medial lip, you have got this muscle A and this muscle B. A is called as teres major, whereas B is called as latissimus dorsi. Latissimus dorsi. Clear? Now let us look one more important thing. One last important thing, guys, that attached to my ribs, what is the muscle do I have attached to my ribs? I told you yesterday that muscle is called as a powerful protractor muscle. You remember that? Attached to my ribs here. What is that muscle? Excellent, excellent. That is called as your serratus muscle. This muscle is called as your serratus anterior muscle. Okay. And next important thing, the last important thing is that this is my scapula. If I'm turning it, this is called as the subscapular region. Subscapular region has also got a muscle like this. What is this called as? Subscapularis. The name of the muscle is subscapularis. So let us name all of them, guys. Let us name all of them. This is your serratus anterior. Okay. This is your pectoralis major. Okay. This is your pectoralis minor. Okay. And this is called as subscapularis. And remember one thing, there was a question long ago that subscapularis is also called as what? Subscapularis is also called as a forgotten muscle. Forgotten muscle. Okay. Subscapularis, but I don't want you to forget this muscle. Okay. Subscapularis is called as a forgotten muscle. So did you understand the borders, guys? Have you understood these borders? Very simple. Because why I'm stressing on this a lot, because many questions are repeated from this, guys. You will get to know how the questions are repeated. Okay. Laterally humerus, medially ribs, posteriorly scapula. Okay. anteriorly pectoralis major and minor. This is the thing I want you to remember. So if you want to understand this clearly, remember like this, that this is the lateral, opposite will be medial, where is pectoralis? Anterior, and this is posterior. Clear? The same thing I have put it down here. I have put it down the same thing. Now let us write all the walls here. Now tell me, anterior wall of axilla. Anterior wall of axilla is formed by what all structures? Only two things as of I know. What are these two things? This is called as pectoralis major. This is called as pectoralis minor. Okay. So pectoralis major, pectoralis minor. These two form the anterior surface of your axilla. Clear? Anterior surface of your axilla. Next important thing. Let us go on to the posterior wall now. Posterior wall of the axilla. Now you will tell me posterior wall is formed by anyone? Very good, Haida. Very good, Birappa. Excellent, Aisha. Very good. Posterior wall is formed by, yeah, obviously. Why not scapula? Scapula, subscapularis, subscapularis. Guys, if you look very carefully here, I want you to concentrate here. When I'm dividing this like this is my anterior, this is my posterior. So posteriorly, what are things are there, guys? Even there is latissimus dorsi here, even there is teres major muscle, isn't it? So can I also write latissimus dorsi as well as teres major? Even they also form the posterior wall. Then now you tell me what forms the medial wall and what forms the lateral wall. Yeah, medial wall is formed by, what is this? Medial wall is formed by, very good, Riza Islam, very good. It is formed by serratus anterior muscle. Now coming to the lateral wall. Lateral wall, it is little bit difficult, guys. I just want you to remember one thing. The lateral wall, this is the medial and this is the lateral wall. First thing I'm writing is humerus, because all of you know that is humerus is forming the lateral wall, right? Along with the humerus, remember just two things. Just two things. Coracobrachialis, biceps brachii. Okay. I cannot show it to you here. Coracobrachialis and short head of biceps. That's it. If you remember this, then all your questions, if you remember this, then all your questions on your axilla will be covered. Okay. Now we shall be discussing the contents anyways. We shall discuss the contents anyways, and there is a very beautiful mnemonic to remember that. So have you understood the borders, guys? All of you, any doubts? Be fast. Have you understood the borders? The boundaries? If I directly put this picture in front of you, it would be difficult for you to understand. So that is the reason why I have drawn this picture and then I have kept the real picture over there. So you understood, right? Okay, guys. Now, first point, let us discuss about the contents. Let us discuss about the contents. After looking at this lecture on axilla, guys, if you want, you can solve any MCQ on axilla. All of them will be covered. Okay, you need not to worry. Okay, I have covered all of them. Okay, don't panic and don't worry. LIAR. Right. So there are four contents, guys. What are these four contents? Okay. Now you tell me, within this, we have got something interesting things. What are these interesting things? Can you look here on the serratus anterior muscle? There is a nerve like this. There is a nerve on the serratus anterior. What nerve can it be, guys, on the serratus anterior? Yesterday we have discussed very much detailed about that. Yeah. Hadia, yes, I will discuss it. Okay. If time persists, I will discuss it, or else in the next class I shall do it. Very good, all of you. Excellent. So the first important thing is the long thoracic nerve. Very good, Hadia. Very good, Eric. Eric, excellent. Lipum, excellent. Lipun. long thoracic nerve. Okay. Next important nerve here is intercostal brachial nerve. Intercostal brachial nerve. Third important thing is that infraclavicular part of brachial plexus. I will teach you brachial plexus and I will tell you it is divided into two parts. Above the clavicle, half of the brachial plexus is there. Below the clavicle, another half is there. Okay. Fourth important part is we are discussing about axilla. So obviously axillary artery will be there, axillary vein will be there, axillary lymph nodes also will be there, isn't it? Sir, it is very difficult for us to remember. Now, how do you remember? How do you remember is that remember by mnemonic LIAR, Juta, right? Liar. L stands for long thoracic nerve, I stands for intercostal brachial nerve, right? And where is A here? There is no A, but just think that this is A, okay? And R stands for axillary vein, axillary artery as well as axillary nerve. Okay, right. So have you all understood this? We are done with the axilla. Have you all understood this? Simple things, guys. We have just talked three important MCQs. One is about cervico-axillary canal borders. Second thing is that we have talked about the borders of axilla. Very easy. And we have talked all the contents. Okay. It is simple. You understood it, right? Right. Now, yesterday I have made a chart. If you remember it, yesterday I have made this chart, isn't it? So I have made this chart. Yes. Yesterday I made a chart that we have to discuss about pectoral region and we are done with the pectoral region. Today we shall discuss about back, scapular, arm, forearm as well as hand. We shall very fastly finish this up. Okay. And from back muscles till the hand muscles, these are very important, very difficult and very high yield, guys. Very important, very difficult and very high yield. So I want your 100% attention here because it is a little bit tricky to understand. So I want your 100% attention. So are you all ready, guys? Are you all ready with this? Okay, fine. Let's start now. Now coming to the muscles of the back region. Coming to the muscles of the back region. What are the names of the muscles? I'll tell you later on. Okay, but let us discuss one by one muscle. The first important thing, as you can look at this picture very clearly here. Now, what is this picture? This part over here is called as external occipital protuberance. External occipital protuberance. Okay. External occipital protuberance. So, from C1 all the way, okay, from C1, C2, C3, C4, C5, C6 and all the way till T12, I have drawn a red line there. Now, this muscle which I am drawing right now is your trapezius muscle, right? Yes, Ayesha, this will be recorded, right? I don't want you to make any notes right now. Just listen to what I am telling because it's very difficult here. All the way from external occipital protuberance down till T12, right? We have got a muscle which is originating. This is called as trapezius muscle. And where is this trapezius muscle inserting? Look here very carefully. The trapezius muscle all the way comes and inserts to the scapula like this. It all the way comes and inserts to the scapula from lower part also. From the upper part and from the lower part. Now, this trapezius muscle is divided into three parts. What are these three parts? See, this is one part, this is second part and this is the third part. Now, look here very carefully, guys. The muscles here are projected in this way. The muscles here are projected in this way. The fibers here are projected in this way. And the name of this muscle is trapezius. So now you understood the origin and insertion from external occipital protuberance till T12. And again I am telling Again, I'm telling, for MBBS students, you have to know it. Students who are preparing for any other exams, you need not to know it, because they're not going to ask you origins and, okay, for next exam definitely they will not ask you. So finally they are inserting to the scapula. Now look here very carefully. There are some fibers attached here. Let us say part 1, part 2, part 3. Now part 1 fibers, when I'm pulling them, scapula is moving in this direction. When I'm pulling them, my scapula is moving in this direction. It means, can I tell my scapula is elevating, right? So can I also call it as, can I also call like this, that superior fibers cause elevation of scapula, elevation of scapula. Clear? Next, there are part number 2. There are some fibers attached directly here, right onto the medial border. So when I'm pulling these fibers, my scapula is moving like this. It is not moving up, it is moving in this direction horizontally. Can I call this as retraction of scapula? When you're stretching your back like this is what your scapula is doing, retraction. Okay. So fibers number 2, called as middle fibers. Middle fibers, they cause retraction of your scapula. Retraction of your scapula. Third important thing, the fibers part number 3, they are attached down here. When I'm pulling them, the scapula is moving downward like this. So can I tell my scapula is getting depressed, right? This is called depression of scapula, right? Can inferior fibers are causing depression of scapula. So overall guys, overall there are 3 functions. What are those 3 functions? Elevation, retraction, as well as depression. Claro? Is everyone clear? Is everyone clear before I go to the next muscle? So origin insertion is finished and the function is also finished. Right. Next muscle, I'm drawing it with the violet color, guys. Next muscle, I'm drawing it with the violet color. Look here, this muscle originates from T6. T6 all the way it comes down. It even covers your iliac, let us say sacrum bone. It even covers your iliac crest. Okay. And all the way, this muscle goes like this. Look here again. This muscle goes all the way and inserts to your bicipital groove. What is the muscle that is inserting to your bicipital groove? I have already talked about it. Yes. Now it is your time to answer, guys. Very good, Piyush. Excellent. The muscle that is called as Latissimus dorsi. Perfect. Latissimus dorsi. Very good. Latissimus dorsi. Okay. This is Latissimus dorsi. Origin T6 till L5. Again, half of the sacrum. Then sacral crest. I mean iliac crest. Then it is going and inserting to your bicipital groove. Bicipital groove. Bicipital groove. Okay. So, one very important thing, guys. What question they can ask you from this? Definite question. Write it down, guys. I'm telling you, write it down. Definite question. You can see an empty gap here. Can you see an empty gap which I'm shading here? Right? Now, can anyone tell me the borders of this gap? I'm just putting down the arrows. You will tell me the borders. See, there is one muscle down. Medially, we have got one muscle. Laterally, we have got one muscle. Okay. Inferiorly, we have got a muscle. Inferiorly, we have got a muscle called as Latissimus dorsi. Medially, we have got a muscle that is called as trapezius. Laterally, we have got scapula. Laterally, we have got scapula. So all these 3 borders, very good, Gopi Raja, Bruce Wayne, perfect. All these 3 together form a triangle called as triangle of auscultation. Even I don't think that your faculty would have taught you this important thing, because this is not present in the old literature, right, which you're following. So this is triangle of auscultation. Triangle of auscultation. Okay, triangle of auscultation. Now why it is called as triangle of auscultation? Because you put a stethoscope over here, you can very clearly listen to the lung sounds. So the lung is basically over here, the lower lobes of the lung are here. You can very clearly listen to all the different sounds of the lung in the lower lobes. This is called triangle of auscultation. First MCQ, very important MCQ, triangle of auscultation. And there were also questions repeated on this, guys. I'll show it to you right now. So you understood it. Second important thing. Second important thing is that, let me move this part. And there's no gap over here. Okay, I'm putting it here. Okay. Next important part is that from the front side, if you see, you can find a muscle over here. This muscle is called as external oblique. Okay, from the back also you will see a little part of this muscle. Okay, now concentrate here. This is the muscle. This is the muscle which you can see here. Okay, this is the muscle which you can see here. Now this muscle is called as external oblique muscle. External oblique muscle. When I discuss about abdomen, I will teach you. Okay, external oblique muscle. Clear? External oblique muscle. Now look here. Here, can you find another triangle here? Can you see another triangle over here? Green color one, right? Now, what are the borders of this triangle? One side I have got external oblique. On the other side I have got, lower side I have got iliac crest, right? Iliac crest in the sense, the alae of the iliac bone are called as iliac crest. And third thing, medially I have got latissimus dorsi. So these three things also together form a triangle. Very good, Bruce Wayne. Perfect. Are you all first year students who are answering me? Let me know. Very good, Sanjay Pandey. Sanjay Pandey is telling that this is called as Petit's triangle. This is called as Petit's triangle. Not only Petit's triangle, it is also called as lumbar triangle. Lumbar triangle. Why? Because all of you might have heard of a term called as hernia. There is some hernia called as lumbar hernia. Lumbar hernia will happen at this triangle. That is why it is called as lumbar triangle. Are you all clear, guys? Right. Now, this was a question that was asked. These two were the questions that were asked. One in June attempt, Fmge, either I think it is in 2015, I think, and another one is 2017 recently. They have asked in December attempt. Okay. So these are the two questions. What are these two questions? Triangle of auscultation is associated with all of the following except. You will tell me the answer now. What is the answer, guys? Yes, tell me. Very good. Very good. Triangle of auscultation is associated with both of them, B and C. I have added one more option, B and C. Clear? Question number 2. Which among the following is not a border of triangle of auscultation? Which is not a border? Question number 2. Very good, Preet Angel. Very good, Harish Reddy. Perfect. Sanjay Pandey, excellent. Sweetie Sri, Siddhant Sharma, perfect. Serratus anterior is not a border of triangle of auscultation. Clear, all of you? Let us enter into the next muscle. So far we have discussed two muscles. Muscle number 1 which we discussed was trapezius. Muscle number 2 which we discussed was latissimus dorsi. Let us look onto the third muscle. So this muscle over here is your trapezius. Trapezius, okay. Let us look on to the next muscle. Now look here, all of you pay attention. There are three muscles here. What are these three muscles are? First muscle arises all the way from C1 till C4. Okay, from C1 to C4 it arises, and look here, it attaches onto the top of the scapula. Second muscle from C7 to T1, right, and this muscle attaches exactly opposite to the medial border. Next muscle arises from T2 till T5, and this muscle attaches to the lower angle of the scapula. The muscle which is on the top, this is called as levator scapulae. Levator scapulae. Sir, why it is called as levator scapulae? Because when I'm pulling this fiber, the scapula is elevated. So I call it as levator scapulae. And next important thing is that I have got two important muscles here. This is called as rhomboid muscle. This is also called as rhomboid muscle. But one is called as rhomboid minor. Another one is called as rhomboid major. ऐसा कैसे? Why? Because rhomboid minor is only from C7 T1. Major is from T2, T3, T4 and T5. Right? So that is why it is major. We are done with all the muscles of the back. Have you understood? If you have understood, then I'll go for the nerve supply. Yes? Very good. Very good. So movements, Siddharth, I have already explained the movements. They are all associated with the movements of scapula. Okay. So look here. We so far discussed about trapezius. We discussed about Siddharth is asking about rhomboid movements. Look here, Siddharth. Rhomboid minor is exactly attached to this part of the scapula, right? So when I'm pulling it, there will be retraction. There will be retraction of scapula. In the same way, rhomboid major is attached to the inferior angle of scapula, right? So when I'm pulling it, there will be depression of scapula. You're clear, Siddharth? Latissimus dorsi, rhomboid major, rhomboid minor, as well as levator scapulae. So these are the muscles. Okay. You're clear, Siddharth? Siddharth, you're clear with this? With the doubt which you had? Right. What are the muscles? Simply remember as TAN. What is TAN? T stands for trapezius. What is A and N stand for? A stands for accessory, N stands for nerve. Accessory nerve. Accessory nerve. What accessory? Spinal accessory nerve. If there is a problem with spinal accessory nerve, what will be the defect? I have explained this in the yesterday's class. What will be the defect if there is a problem with the spinal accessory nerve? Yeah, if you have watched my lecture yesterday again and again for revision, you might have answered it. Sanjay Pandey, not winging of scapula, it is partial winging. Ravi Chauhan, excellent. It is partial winging of scapula. Okay, partial winging of scapula. Sir, how to remember latissimus dorsi, rhomboid major, minor and levator scapulae? Very, very, very easy. Just follow what I'm teaching you. Okay. Look here. How do you remember latissimus dorsi? Where is this latissimus dorsi located? In the thoracic region. On the back, in the thoracic region. So the nerve is thoraco. And where is it? On the ventral side or on the dorsal side? It is on the dorsal side, on the back. Thoraco dorsal nerve. Thoraco dorsal nerve. Next important thing, rhomboid major, rhomboid minor. Look at these muscles. Where are they attaching? Are they attaching to the ventral side or are they attaching onto the dorsal side? They are attaching onto the dorsal side. So the nerve is dorsal scapular nerve. Sir, if it is dorsal scapular nerve, because they are attaching onto the dorsal side, then levator scapula is also attaching to the dorsal side. Then what is the nerve supply? It is also dorsal scapular nerve. It is also dorsal scapular nerve. We are done discussing the muscles of the back, right? We shall go on to the muscles of the scapular region, right? We are done with the discussion of this, right? So we are discussing right now the muscles of the scapular region. So you understood the muscles of the back. Now let us enter into the muscles of scapular region. So how to remember the muscles of scapular region? Very easy thing. Remember it as D sits. D sits. What does D stand for? D stands for deltoid. D stands for deltoid. And what does S stand for? Look here. Simple thing. This is scapula, right? This is scapula. And what is this? Humerus. Humerus is attached to the scapula here. Humerus is attached to the scapula. Now there is a muscle here. This muscle is called as deltoid. Done. Second one. Look at the scapula here. Above the spine, this region is called supraspinatus. Below the spine, this region is called infraspinatus. If there is a muscle attached above the spine, I call it as supraspinatus muscle. If there is a muscle attached below the spine, I call it as infraspinatus muscle. So two muscles are also done. One is called supraspinatus. Another one is called as infraspinatus. Okay. And what does T stands for? T stands for teres major as well as teres minor. And finally, what does S stand for? You told me there is some forgotten muscle here. What is that? Subscapularis. Subscapularis. So very easy to remember. Just five muscles: deltoid, above the spine, below the spine, subscapularis, teres major, minor. Okay, teres major and minor. Now, this question has been repeatedly asked, repeatedly asked. How they asked is that they have given you the image and they asked where is it inserting. This is the question that is repeatedly asked. What is this question? First of all, this is your clavicle. Okay. From where does, what is the origin of deltoid muscle? Look here. Origin of deltoid muscle is from lateral 1/3 of clavicle. Shashi Bhushan, muscles of rotator cuff, I will explain now. Okay, in a minute I'll explain. Lateral 1/3 of clavicle, acromion process, and also spine of the scapula. Spine of the scapula, acromion process, and lateral 1/3 of the clavicle. From here, the deltoid muscle will originate, and this deltoid muscle inserts onto the deltoid tuberosity like this. It inserts exactly here onto the deltoid tuberosity. So this was a question that was asked. It is inserting to deltoid tuberosity, and all of you should also remember this is from lateral 1/3 of clavicle. Lateral 1/3 of clavicle. Okay, lateral 1/3 of clavicle as well as from the spine of the scapula. Right, we are done discussing the deltoid. Second important thing. What did I tell you? I told you that above the spine, this muscle is called as supraspinatus. Below the spine, this muscle is called as infraspinatus. And after that, I told you we have got two more muscles: teres minor, teres major. Teres major, I will not tell you because you already know. Teres major attaches to which lip? Medial lip or lateral lip? Is the image blur? Is the image blur, guys? Okay, fine. So medial lip or lateral lip, obviously it is attached to the medial lip. Very good, Siddharth. Excellent, excellent. Very good. Look here now. So we have got a muscle that is attached like this. This is called as teres minor. We even have, yeah, we even have a muscle that is attached onto the lateral lip, sorry, medial lip. This is called as teres major. So this muscle is called as teres major. I'm going to tell you one very difficult thing right now. All of you concentrate. Now, this muscle is called as teres minor muscle. This, what is this muscle? Teres minor muscle. Teres minor muscle. Okay. Now, this question has been, two questions from the scapular region are repeatedly asked. What are these two questions are? First question is that where are these muscles originating? They don't ask you because you know very well. Supraspinatus, infraspinatus, subscap, you know it. They are going to ask you, where are these muscles inserting? I'm telling you guys, listen to this part very carefully. It is very important. Where are these muscles inserting are point number one. Point number one is that supraspinatus attaches to the greater tubercle. I told you yesterday that this is the humerus. It has got a greater tubercle. It has even got a lesser tubercle. So supraspinatus attaches to the greater tubercle. Then where does infraspinatus attach? Infraspinatus also attaches to the greater tubercle. Then where does teres minor attach? Teres minor is also attaching to the greater tubercle. Then where does teres major attach? It attaches to the medial limb. So you are telling me that supra supraspinatus, infraspinatus, and teres minor. You are telling me these three are attached to greater tubercle? Yes, these three are attached to greater tubercle. And where is teres minor attached? To the medial limb. Very, very, very important, guys. Very, very, very important. Any exam you go, any Viva exam also you go, right? Definitely they will ask you this question. Definitely and definitely they're going to ask you this question. Keep this thing in mind, please. Okay? Keep this thing in mind. Now, what are rotator cuff muscles? All of you might have known that this is a famous question, right? Need not to tell because you know this. What are the rotator cuff muscles? So, we have got supraspinatus, we have got infraspinatus, okay? We have got teres minor, we have got subscapularis. Sir, you forgot to mention one muscle. Yes, that muscle is teres major muscle. Teres major is not included under rotator cuff. Only teres minor is included under rotator cuff. So what are the four rotator cuff muscles? Supraspinatus, infraspinatus, teres minor, and subscapularis are the rotator cuff muscles. Okay, rotator cuff muscles. You know, I know all of you that you have a mnemonic sits, right? But the examiner also know that mnemonic. So he will confuse you here. Instead of teres minor, he will give you teres major. Are you sure? Yes. Because previously there was a question once asked. Look here. What was this question? Which of the following muscles does not form part of rotator cuff? This was a question. Supraspinatus is there, infraspinatus is there. Sorry, supraspinatus, infraspinatus, teres major, teres minor. What will be the answer? Very good. B. Teres major is not a part. Teres minor is a part of that. Okay. So 1, 2, 3. Sorry. Yes. 1, 2, 3, and 4. Okay. Clear, everyone? Now, first question is, what are the rotator cuff muscles? Okay. Second important question is that the first three, where do they sit on? They sit on greater tubercle. They sit on greater tubercle. And where does subscapularis will sit? It sits on the lesser tubercle. Not trochanter. It is tubercle. Greater tubercle and lesser tubercle. Okay. Next important thing, guys. They have also asked you one very important thing. Out of all these rotator cuff muscles, which is the muscle that is most commonly injured? Most commonly injured. Which is the muscle that is most commonly injured? Very good, sweetie. Very good. Life cycle. No, life cycle I haven't answered. The most commonly injured muscle is supraspinatus. Why supraspinatus? You know, look here now very carefully. This is how, right? This is how it is attached like this. This is how your humerus is attached. Now, where is supraspinatus? Look here very carefully. This is supraspinatus. Okay, supraspinatus is like this. Wherever my index finger is there, this is the place of supraspinatus. Okay, this is the place of supraspinatus. It means, can I tell like this? Yes, this is my supraspinatus. So mostly commonly it is injured because it is more superficially located. So mostly injuries will happen to supraspinatus muscle. Okay, mostly injuries will happen to supraspinatus muscle. And second important thing, when I'm pulling my supraspinatus, look here, when I'm pulling my supraspinatus, what is happening to my arm? My arm is abducting or adducting. It is moving laterally. Laterally is called abduction. When I'm pulling my supraspinatus, it is causing abduction. Keep this thing in mind. Okay. So supraspinatus is the most common injured muscle. And supraspinatus function is initial abduction. Initial abduction means यहाँ तक abduct कर दिया और छोड़ दिया. It is not like this, okay? It is only initial abduction. ठीक है? 0 to 15 degrees only. From 15 degrees to 90 degrees दूसरा मजिल है, वो मैं बाद में बताऊंगा. But now 0 to 15 degrees supraspinatus. Very, very good, guys. Very good, Bruce. Excellent, Bruce. Clear? So this is all you need to know. And one last important point regarding the nerve supply of this is that it is very easy to remember the nerve supply. Remember it as SALU. You know, SALU. In Hindi, SALU is different. In Telugu, SALU is different. Okay. So what is SALU? Supraspinatus is supplied by suprascapular nerve. Suprascapular nerve. Infraspinatus is also supplied by suprascapular nerve. Teres minor is supplied by A. A stands for axillary nerve. Axillary nerve. And teres major is supplied by L. L stands for lower subscapular nerve. Lower subscapular nerve. Then what is U? If there is lower, there will be upper. So upper subscapular nerve. Easy peasy, right? Understood? Yes, Shashi is telling axillary also supplies deltoid. Yes, Shashi, it is right. I will tell you later on those things. Okay. Naresh is telling that 15 to 90 degrees is deltoid. Very good, Naresh. It is right. 15 to 90 degrees is deltoid. Okay. When I will be discussing specifically about deltoid later on, I'll tell you, but that is not that important for you to remember. Okay. So whatever I'm teaching you, that would be enough for you. So have you all understood, guys? Now I'm going on to the clinical part. So in rotator cuff muscles, we are about to finish this session. Don't worry. In rotator cuff muscles, what are the things we have discussed? Muscles का नाम, name of the muscles, done. First thing. Second thing हमने ये बोला कि deltoid जाके deltoid tuberosity को insert होगा. Second thing खत्म. Third thing, supra infra minor जाके ग्रेटर ट्यूबरकल को इंसर्ट करेगा और टेरिस मेजर जाके मीडियल लिप को इंसर्ट करेगा. खत्म. नेक्स्ट, मोस्ट कॉमन इंजुर्ड इज supraspinatus, finished. Initial abduction, supraspinatus, finished. Coming to the nerve supply, SALU. Clear, everyone? Yes, Abhiram, Bruce Wayne, Naresh, Shashi, all of you are clear. Adil, very good. Now let us enter into the most important and clinical part. Most important and clinical part. All of you put your pens down. Just look at what I'm writing. This is called as coracoid process. This is called as coracoid process. This is called as acromion process. Acromion process. Okay. Between the coracoid process, between the acromion process, I have got a ligament here. This is called as coracoacromial ligament. This is called as coracoacromial ligament. Okay. Why are you telling this? Because we are discussing these rotator cuff. Why are you telling this? The reason is that they have asked a question. Coracoacromial arch is formed by. So you got an arch like this. This arch is formed by three things: coracoid process, coracoacromial ligament, and acromion process. Clear? MCQ. Another one also finished. Next important thing. ये कौन सा मसल है? कैन एनीवन टेल व्हाट इज दिस मसल हियर? Very good, Revant Reddy. It is deltoid muscle. Deltoid muscle. और एक चीज मैंने पहले भी बोला था, starting also I told you, there is a muscle that is running down like this. Running down. What is that muscle? This is your supraspinatus muscle. Supraspinatus muscle. Okay. Good evening, Mohammad Razik. Good evening. This is supraspinatus muscle. Okay. Look at the supraspinatus very clearly because later on I am going to show you one very important thing. और एक चीज, डेल्टॉइड और एक्रोमियन प्रोसेस के नीचे you can see a brinjal colored bursa. Can you see this? So some scientists tell that this is located beneath the acromion process, so they started telling subacromial bursa, and some scientists started telling no, it is located below deltoid, so they started telling subdeltoid bursa. दोनों भी सही है. Why are you teaching this? Because if there is an inflammation, if you are overusing your shoulder, cricket खेलते टाइम, bowling करते टाइम पे अगर ज्यादा यूज किया, ज्यादा स्ट्रेन किया शोल्डर को, then what will happen is that this bursa will be inflamed. This bursa will be inflamed. So inflammation of this bursa is called as subacromial bursitis. What is that called? Subacromial bursitis. Clear? Subacromial bursitis. Okay. Now, one very important thing. Look here. For some patients, what will happen is that ये supraspinatus muscles. Guys, are you fine with my Hindi? Can you all understand? Yeah. Hi, Kiran. So, in this supraspinatus muscle, what will happen is that sometimes, okay, not all the times, sometimes, okay, I'll speak in English only. Sometimes, what will happen is that, look here very carefully. Sometimes, what will happen is that there will be some calcium deposition going on. There will be some little bit of calcium that will be deposited on this supraspinatus tendon. You see, there is a calcium deposition on this. So when calcium gets deposited, the muscle will become stiff. So when the muscle will become stiff, the patient can't even abduct his arm. There will not be initial abduction of the arm. This is called as calcified supraspinatus tendinitis. Okay. So calcium deposition within the supraspinatus muscle is called as calcified supraspinatus tendinitis. Calcified supraspinatus tendinitis. So patient will have very severe pain here. This is also called as painful arc syndrome. What is this? It is also called as painful arc syndrome. Painful arc syndrome. Okay. Are you all clear? Because why am I stressing on this point is that recently, guys, they have given one MRI scan, not in anatomy. Okay. In radiology, Fmge, they have given an MRI scan and they have asked what is this condition. Obviously, radiology in the sense it is equivalent to anatomy. Everything will be clinical orientation. So look here now. Look here. First thing is that you have to identify a muscle. This is an MRI scan. In this, look here, this thing which you can see here, let me use another, see this muscle which you can see here, what is this muscle, guys? Anyone? मोहम्मद राजिक, 1 घंटे पहले से मैं क्लास ले रहा हूं, बट डोंट वरी, ये वीडियो यहाँ पे ही रहेगा, ठीक है? वेरी गुड. दिस इज कॉल्ड डेल्टॉइड मसल. Next important, I'm rubbing the deltoid now. I'm rubbing the deltoid. Look here. See guys, very clearly I'm drawing here. There is another muscle that is going like this. Can you see here? I'm rubbing it. Look here very carefully. What is this muscle? Very good. Very good. Supraspinatus. Supraspinatus, right? compare the same MRI. This is a normal MRI. Normal MRI. Compare the same MRI onto the opposite side. Exactly in that region, you can see this white color deposition. This is called calcified supraspinatus tendinitis. Calcium deposition. As it is, exam में यही question आया था. As it is, this question only was asked in the exam. Are you clear now? Very good. Very good. Are you clear, guys? Very good. Clear? We are even done with the muscles of the back and muscles of the scapular region. Now, yeah, you have got some questions over here. You know, when this question was asked, this question, after this session, we shall have a session on thorax. I mean, in the subsequent sessions, Aska. This question was asked in August exam, where the first time clinical pattern was set up. That time, this question was asked. Look here. A 58-year-old man presents to the clinic with a 6-month history of shoulder pain. 6 महीने से shoulder pain. Over the weekend, he strained his shoulder. He strained his shoulder. मैंने क्या बोला था पहले? Overuse of shoulder. Overuse of shoulder should not be done. On exam, he complains pain, palpation just below the acromion. You suspect he has a torn supraspinatus. If correct, which of these functions will be affected? Tell me. Which of the function will be affected? Very good. Very good. It is initiation of abduction. Initiation of abduction. Clear? Initiation of abduction. Very good, guys. Perfect. And this one, you know, infraspinatus is inserted too, obviously. Supraspinatus, infraspinatus, teres minor is inserted too. Very good, very good. Greater tuberosity, right? Greater tuberosity, greater tubercle. Okay, very good, guys. Very good. And yeah, tell me this one. A 32-year-old male was brought to the emergency department after being injured in a mob violence. The patient had a penetrating injury in the right shoulder region by a sharp glass piece. On examination, there was drooping of right shoulder associated with partial winging of scapula. Partial winging of scapula, very good. Spinal accessory nerve. All these questions were previously asked, and I'm really happy that you guys are answering this. Very good, guys. Very good. Right. So let us fast up the. Let us fast it up. Now we shall be discussing the muscles of the arm. Very easy, guys. Nothing to remember. Look here. Muscles of the arm. Whenever I'm telling you muscles of the arm, remember one very important thing. Okay. What is that important thing is that this is my anatomical position. For all the first years and third years, I'm telling. This is my anatomical position. Now, whatever you can see, this is called as the flexor region. So, all these muscles here are called as flexors. All these muscles are flexors. And when I turn back, whatever muscles you can see on my back, these are called as extensors. Okay? Flexor. What do I mean by flexor? Flexor means when I'm flexing it, the angle is decreasing. This is called flexion. When I'm extending it, the angle is increasing. This is called extension. Okay, these are flexors, these are extensors. That's it. So from now onwards, whenever I pick up one muscle from the flexor region and ask you what is the name of, what is the function of this muscle, you should tell it as flexion. Okay. Now, arm has got two compartments, anterior compartment, posterior compartment. Anterior compartment is also called as flexors and posterior compartment is also called as extensors. Okay. Now, how do you remember anterior compartment? Remember it as BBC. What is BBC? B stands for BBC. Okay. B stands for biceps brachii. Another B stands for brachioradialis. Another C stands for coracobrachialis. Sorry, this is not brachioradialis, it is brachialis. Okay, I'm sorry. So biceps brachii, brachialis, and coracobrachialis. Now, when it comes to extensors, we have got what? Triceps brachii. Triceps brachii. Triceps brachii. Okay. Now, when I discuss about biceps brachii, within the biceps brachii, there are two important heads. One is called as the small head. Another one is called as the large head. Okay, or you can call it a short head and long head. Okay, short head of biceps brachii, long head of biceps brachii. In the same way, triceps is also having three heads. What are that? We have got long head, we have got lateral head, we have got medial head. We have got medial head. Here we have got medial head. Now, one very important thing you have to remember is that what is the muscle that is supplying your entire anterior compartment? The entire anterior compartment is supplied by a nerve called as musculocutaneous nerve. Musculocutaneous nerve. The entire posterior compartment is supplied by a nerve called as radial nerve. Radial nerve. Okay, but in some individuals what will happen is that this brachialis is supplied by two nerves. What are those two nerves? It is supplied by musculocutaneous nerve, also it is supplied by radial nerve. That is the reason why brachialis is called as a hybrid muscle. किस मसल्स को तुम हाइब्रिड मसल्स बोलोगे? Those muscles which are having dual nerve innervation. Right? In some individuals, brachialis is supplied by musculocutaneous and radial. So you call this as hybrid muscle. Clear? All of you are clear with this? Yeah. Next important thing. Next important thing is that there is no need for us to discuss all the muscles. We will just discuss two muscles here: biceps brachii and triceps brachii. These two differences are very important. Look here now. Look here. Now in this scapula, here, if you look at the scapula, this is your glenoid cavity. Now, in this glenoid cavity, here you have got supraglenoid tubercle and here you have got infraglenoid tubercle. Okay, this is supraglenoid tubercle and this is infraglenoid tubercle. The same thing I am showing it to you here. This is supraglenoid tubercle and this is infraglenoid tubercle. Okay, now I am discussing about biceps brachii. In biceps brachii, what did I tell you? We have got two heads, short head and long head. Now look here very carefully. Short head arises from the coracoid process. Short head arises from the coracoid process. This is your coracoid process. Short head arises from the coracoid process. This is called as your short head. Okay, whereas long head arises from the supraglenoid tubercle. Supraglenoid tubercle से long head आएगा. Long head arises from supraglenoid tubercle. Now both of them will form a muscle like this and they will insert to radial tuberosity. They will insert to a tuberosity on the radius. This is called as radial tuberosity. Radial tuberosity. Clear? So short head is arising from coracoid process. Long head is arising from supraglenoid tubercle, right? Is arising from supraglenoid tubercle. And where is it inserting? It is inserting to radial tuberosity. Radial tuberosity. This is an important thing which you need to know. Okay. Now, can anyone tell video stuck? అయిందంట చూడు. Is the video clear now? Is the video clear? Yeah. So look here, radial tuberosity. Why am I stressing on this point is that, guys, previously they have directly given an image, right? They have directly given an image and they pointed at this radial tuberosity and asked what is the insertion point of this muscle. So first of all, you should know the name of the muscle, then you should know what is it inserting to. Only two muscles are asked, this one biceps as well as the triceps. Okay, and one very important thing you need to remember is that obviously biceps is responsible for flexion, but the most important thing you have to know is that this biceps muscle, this biceps muscle is the strongest supinator. You know, there is something called pronation, supination, right? This is pronation, supination. Strongest supinator is your biceps muscle. Keep this thing in mind. Biceps is your strongest supinator. Biceps is your strongest supinator. Now let us go on to the next muscle, that is your triceps muscle. Okay. Now triceps muscle has got how many heads? We have got long head, we have got medial head, we have got lateral head. Okay. Now look, from where does long head originate from? Long head originates from the infraglenoid tubercle. From the infraglenoid tubercle, the long head will originate. Then where does the medial head originate from? Medial head will originate superior to the radial groove. You see, here we have got something called as radial groove, right? This black one you can see here. This is called as your radial groove. Above the radial groove, the medial head will start. Below the radial groove, the lateral head will start. Okay. So, above the radial groove, the medial head. Below the radial groove, the lateral head. So, from all these three places, this is the muscle that is coming on the back. This is called as your triceps muscle. Okay. So, let us write down all these things. Long head starts from infraglenoid tubercle. Sir, why not supraglenoid? Because supraglenoid is biceps. Medial head is superior to radial groove. Superior to radial groove. Lateral head is inferior to radial groove. Inferior to radial groove. Everyone clear, guys? We are done discussing the muscles of the arm now. Everyone is clear with this? Yeah? Yeah. Now concentrate on one thing. Concentrate on one thing. In if you are students who are preparing for Neet PG, for you it will be useful. Students who are MBBS, for you also it will be useful. What is the question is that in INSET exam recently they have asked this question. What is that question which they have asked is that, look here very carefully. See, this is proximal, this is distal. Okay, biceps is attached here. For example, if the tendon of the biceps, in the proximal region, if this tendon is torn away, if there is a tear in the tendon, or let us say if the tendon is cut, I have manually cut down the tendon. What will happen? Where will the biceps go? The biceps will be dragged downwards. It will be dragged downwards. So when I flex my arm, when I flex like this, when I flex my elbow, the deltoid, the biceps muscle, I can see it here in the form of a lump. Why? Because it is not in the center. Why? Because here it is torn away. The tendon is torn away. Right? If you look at the muscle here, look here. How is this muscle? The tendon here is torn away. The tendon here has been torn away. There is a rupture of the tendon. So the muscle moved downward like this. This type of muscle is called as Popeye muscle. You know the Popeye, the sailor man? So this muscle is called as Popeye muscle. Popeye muscle. Popeye muscle is because of the proximal biceps tendon rupture. Popeye muscle is because of the proximal biceps tendon rupture, right? So 20 more minutes, guys, and 20-25 more minutes we shall finish up the session. Okay, so you understood it, right? Very good. We are done with the muscles of the back, we are done with the muscles of the scapular region, we are done with the muscles of the arm. Now the most difficult muscles are your muscles of your forearm. Are you ready with me? Naresh, triceps insertion is onto the olecranon process. Okay, it is inserted to the olecranon process on the back. It is not important. That's why I did not tell you. Right. So let us enter into the muscles of the forearm. All of you, don't write anything now. Look here. Muscles of the forearm. This is my anatomical position. Here also I have got flexor muscles. Here I have got extensor muscles. Okay. Now all the flexor muscles are originating from one point, that is medial epicondyle. For example, if I am putting this bone like this, okay, I think this is the left side bone. So if I am putting this bone like this is medial epicondyle, this is lateral epicondyle. All my flexors are originating from the medial epicondyle. All my extensors on the back, they are originating from the lateral epicondyle. Clear? Flexors, medial epicondyle, extensors, lateral epicondyle. Okay. If there is a inflammation of medial epicondyle, then all my flexors will suffer. If there is a inflammation of lateral epicondyle, then all my extensors will suffer. So from today onwards, if I ask you common flexor origin, medial epicondyle, common extensor origin, lateral epicondyle, I think this explanation is clear for you, right? So in the anterior group, anterior or flexor, posterior or extensor, posterior or extensor. Okay, now in the anterior group we have got two important things. One is superficial, another one is the deep group muscles. Now what are these superficial muscles? Muscle number one, muscle number one, again I'm not telling you that this is medial epicondyle, that is common flexor origin, medial epicondyle, common flexor origin. This is lateral epicondyle, common extensor origin. Medial epicondyle and lateral epicondyle, one is common flexor, one is common extensor origin. Okay. Now the first muscle, all the muscles will originate from medial epicondyle. So the first muscle is also originating from medial epicondyle. Origin is done. This is origin. When it comes to insertion, where it is inserting? It is inserting onto the anterior side, but onto which bone? It is inserting onto the radius bone. Okay, can I tell it is inserting onto the anterior surface of radius? Anterior surface of radius. Okay, anterior surface of radius. Done. This muscle is called as pronator teres. Pronator teres. Why are you calling it as pronator teres? Because this muscle is responsible for pronation, not supination. It is only pronation. Okay, that is why it is called pronator teres. Let us go on to the next muscle. Look at this. This muscle is also originating from medial epicondyle. This muscle is also originating from medial epicondyle. But look here very carefully that this muscle originates from the medial epicondyle. This muscle originates from the medial epicondyle. Now this muscle passes all the way onto the radial side. It is passing onto the radial side and coming down all the way towards the carpal bones on the radial side, right? So here we have got the carpal bones. This is the radial side carpal bones. This is the ulnar side carpal bones. So the muscle is going all the way towards the radial side of the carpal bones. So what is this muscle called as? It is coming from the flexor origins of flexor. It is going towards the carpal bones of carpi onto the radial side, so radialis. It is called as flexor carpi radialis. As you can look in the picture, this is called as flexor carpi radialis. Flexor carpi radialis. Because it is going on to the other side. Next important muscle. Next important muscle. This muscle also starts from the medial epicondyle like this. And this muscle has got a short belly. But the tendons of this muscle are too long, guys. They're too long like this. And they are attaching to this green color thing. What is this green color thing here? This is called as flexor retinaculum. Flexor retinaculum. So these tendons are attached to flexor retinaculum. Now, where is this flexor retinaculum? Question number 1. Flexor retinaculum is located in the palmar region, right? Like this. Somewhere here, flexor retinaculum is located. And this muscle is having long tendons. So, the name of the muscle is palmar longus. Palmaris longus. Palmaris longus. Okay? Clear everyone? Palmaris longus. Next important muscle. Next important muscle. But before going to that important muscle, one very important clinical point I want to tell you here is that, look here, this is the palmaris longus, right? So this is the tendon of palmaris longus. 1, 2, 3, 4. Tendons of palmaris longus, right? I told you because palmaris longus is having 4 very long tendons. So these are the tendons of palmaris longus. But the important thing is that in between these tendons, we have got a fibrous tissue like this. We have got a fibrous tissue in between these tendons. This fibrous tissue is called as palmar aponeurosis. Palmar aponeurosis. Palmar aponeurosis. Now, what I'm trying to tell you? What I'm trying to tell you is that, look here, the medial side of the palmar aponeurosis. This is the medial side, right? The medial side of the palmar aponeurosis. Here, within this tissue, there is a lot of fibers getting deposited. A lot of fibers, a lot of fibrous tissue gets deposited there. When a lot of fibrous tissue gets deposited there, what will happen? The tissue there, it will become so stiff. So when it will become so stiff, look at the picture below. This is how the patient's hand looks. When the tissue becomes so stiff, this is how the patient's hand looks. This is because of the contraction of palmar aponeurosis on the medial side. This is because of the contraction of palmar aponeurosis on the medial side. Can anyone tell what is this condition? Very good. Bruce Wayne, perfect. All the first years guys, are you understanding guys? First year students and third year, fifth, sixth semester students. Are you understanding or it is boring? Yeah? Carmen, you're understanding, right? You're understanding, right? Everyone? Fine, guys. So this condition, guys, I want you to keep on messaging me whenever I ask you whether you're understanding, because it is obviously of no use if you don't understand this thing, right? So in between, I'll be asking you. So this is called as Dupuytren's contracture. Dupuytren's contracture. Dupuytren's contracture. Right? So guys, everything that is related for your next exam, every point whatever I'm teaching you, I'm relating it with the clinical, because clinical is the main agenda. It is a main funda of the examiner who's setting the paper for next exam. Keep this thing in mind. Keep this thing in mind. Yes, Bruce, it is also seen in liver cirrhosis also, you see this condition. Okay, right. So you understood what is Dupuytren's contracture, right? So let us continue. Now look here. There is another muscle that is obvious, it will start from the flexor origin. This goes all the way now. It is going towards the ulnar side. You see, it is going towards the ulnar side, towards the carpal bones on the ulnar side, and it is inserting here. So flexor carpi onto the ulnar side. So ulnaris. This is called as flexor carpi ulnaris. This muscle is called as flexor carpi ulnaris. Very good, Akshay. Very good. Flexor carpi ulnaris. Next important thing. What is the next important thing? Look here very carefully. This is your radius bone and this is your ulna bone. Okay. On the surface of ulna, you have got a small process. This process is called as coronoid process. This one is called as coronoid process, not coracoid process, coronoid process. Okay. From the coronoid process, there is a small ligament that is attached to another oblique line. On the radius bone, you have got an oblique line, right? Now, this is called as oblique line of radius. This is called oblique line of radius. Oblique line of radius. So this ligament that is attached from coronoid process to the oblique line of radius, this ligament is like an arch. So this is called as an arcuate ligament. What is this ligament called? This ligament is called as arcuate ligament. Now from this arcuate ligament, the muscle starts coming down, and this muscle is nothing but this muscle which is shown here. So here you have got your arcuate ligament like this, and from here you see a muscle that is hanging down. This muscle, very good, very good. This muscle is called as flexor digitorum superficialis. Why flexor? Because we are discussing flexor muscles. Why digitorum? Because this muscle is inserting to all the digits. All the digits you see there, it is inserting to the digits of 1, 2, 3, 4, 5 phalanges, right? Why superficialis? Because right now we are concentrating on the superficial group muscles. Clear? Flexor digitorum superficialis. One very important MCQ I want you to remember here is that flexor digitorum superficialis inserts to which phalanx? See, this is called as distal phalanx. This is called as proximal phalanx, and this is called as the middle phalanx. Middle phalanx. Okay, so it is inserting to the middle phalanx here. It is inserting to the middle phalanx. Very good, guys. So this is an important MCQ which they will confuse. It is inserting to middle phalanx. Okay, so this is 2, this is 3, this is 4, and this is 5. Clear, everyone? Right. So guys, so what I'm trying to tell you is that we shall write down the names. Sir, how do you remember? Because it is very difficult. Many muscles are there. Simply remember it as PF, 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 PF. Right? Is it difficult to remember? P stands for pronator teres. Pronator teres. F stands for flexor carpi radialis. Again, P stands for palmaris longus. Palmaris longus, which is attached to flexor retinaculum. You remember it? Next, again, F stands for flexor carpi ulnaris. Okay. Sir, again there is P. No, there is no P this time. There is F. What is this F? Flexor digitorum superficialis. Sir, if there is flexor digitorum superficialis, why not flexor digitorum profundus? All of you remember first year students? Profundus means deep. Superficialis means superficial. Okay? You cannot call it as flexor digitorum deepalis. It's flexor digitorum profundus. So opposite of flexor digitorum superficialis is flexor digitorum profundus. Okay? Flexor digitorum profundus. Again the same. PF. What is P next? Pronator quadratus. Pronator quadratus. Again, what is F? Flexor pollicis longus. I will tell you what is that. Okay. So let us go back to the pictures. Let us go back to the pictures. Now here you have got another muscle. Look here. This is the muscle that is coming down all the way like this. It is coming down all the way, and it is It is also having 1, 2, 3, 4 tendons. Previous muscle is also having 4 tendons. This is also having 4 tendons. But what is the difference? That is attached to middle phalanx. But here it is attached to distal phalanx. It is attached to distal phalanx. This is a very important MCQ. It is attached to distal phalanx. And this is flexor digitorum profundus. Okay. Flexor digitorum profundus. Sir, what is this muscle then? You see there is one more muscle here like this. This is a separate. Then what is this muscle then? There is one more muscle you can see here. This is a separate muscle, and it is attached only to the thumb, right? It is attached only to the thumb. Look here. First of all, what this muscle has to be called? Flexor muscle. Flexor. What do you call thumb in Latin? In Latin, you call it as pollicis. Thumb in Latin, you call it as pollicis. Okay. Flexor pollicis, and the tendon is too long, so longus. So this muscle is simply flexor pollicis longus. Flexor pollicis longus. Right? Clear? I hope we are done with the discussion of the superficial and deep muscles of the forearm. Okay? Deep muscles of the forearm. Now, I can understand, but that there are many muscles that are located in the forearm. So, how to remember the nerve innervation for each and every muscle? It is very difficult to remember the nerve innervation for each and every muscle. But one very important thing is that remember this statement. All the muscles of anterior compartment are superficial and deep muscles. All the muscles of anterior compartment are supplied by median nerve except one and a half muscle. Okay, again I'm telling you, all the origins and insertions actually are not needed. Okay, whatever are needed I'll be telling you. All the muscles of anterior compartment are supplied by median nerve except one and a half muscle. Look here, all muscles of your anterior compartment are supplied by median nerve except one and a half muscle. What is that one and a half muscle? That one muscle is flexor carpi ulnaris. That half muscle is medial half of flexor digitorum profundus. Flexor digitorum profundus. Okay. So we have discussed flexor carpi ulnaris, right? Where is that muscle? Flexor carpi ulnaris. It is not supplied by median nerve. It is supplied by ulnar nerve. Ulnar nerve. How to remember? Ulnaris, ulnar nerve. Next, flexor digitorum profundus. Flexor digitorum profundus. If you divide this flexor digitorum profundus into two halves, look here. This is called as the lateral half. Okay, and next this is called as the medial half. The medial half is supplied by ulnar nerve. Lateral half is as usually supplied by your median nerve. One and a half. So both of them are supplied by ulnar nerve. Is it difficult to remember these muscles of the anterior compartment, guys? Posterior are dead easy than this. Is it difficult to remember? Have you understood all the muscles? Ritika, part 1 is already uploaded. Right? Easy. Easy, right? Right, guys? Right. Look here now. This question is asked again and again. What is this question? If there is a tendon that is going like this, I should call this tendon as flexor tendon or extensor tendon. Tell me, flexor or extensor? Flexor. Very good. Flexor. I'm turning back. If there is a tendon that is going like this, I should call it as flexor or extensor on the back. Extensor, very good, because I told you starting, these are flexors, these are extensors. Done. Now look at this picture. Now you tell me, the flexor tendon is broken or extensor tendon is ruptured? Tell me, flexor tendon is ruptured or extensor tendon in this picture? Yeah, extensor. Piyush, very good, because it is on the back here, right? So this is extensor tendon. So there is extensor tendon rupture, right? Look at the next picture. This is the first picture. Look at the next picture. Along with that extensor tendon, a part of bone has also been broken down. So you call this as evolution fracture. Evolution fracture of what? Evolution fracture of extensor tendon. Extensor tendon. Okay, such type of fracture, when you look at the patient's finger looks like this, right? This is called as swan neck deformity. Like a swan neck, the finger is located, right? This is called as swan neck deformity. What is this called? This is called swan neck deformity. Swan neck deformity. So, evolution fracture of extensor tendon is leading to swan neck deformity. Such type of fracture you call it as mallet finger. You call it as mallet finger, or you can also call it as baseball finger. Baseball finger. While playing baseball, the digits here they are mostly injured. Mallet finger or baseball finger, very, very, very important. Very, very important, I'm telling you. Okay. Now let us put everything opposite to this. Everything opposite to this. What is the opposite thing? Extensor tendon here. But opposite is flexor tendon. If flexor tendon is ruptured, or evolution fracture with flexor tendon, evolution fracture with flexor tendon, right? That is called as jersey finger. Okay. So you have to know the difference. What is the difference? Extensor tendon is mallet finger. Flexor tendon, exactly here. Flexor tendon, that is called as jersey finger. Jersey finger. Jersey finger. Okay. Sir, how to remember it? How do you remember? How do you remember is that jersey? What is jersey? Jersey is a cow. Now, how do you take the milk of the cow? You don't climb on the cow and take the milk, right? You go beneath the cow and then take the milk. So beneath the lower part is always jersey. Remember in this way, right? If you have any other ways, that is well and good, right? But this is all the way I got. Clear? Now, yeah, look at this X-ray here. Now tell me, is it a mallet finger or is it a jersey finger? You will tell me. Mallet or jersey? Very good. Excellent, guys. Excellent, excellent. This is jersey finger. This is called a jersey finger. Right. Now coming to extensors. So extensors are very easy. Now how do you understand these extensors? First important point. First muscle brachium means this, okay? From the brachium to the radius brachioradialis. From the brachium to the radius brachioradialis. First muscle finish. Second muscle. Second muscle is extensor point. Where is this extensor point? This is flexor point. Lateral epicondyle is extensor point. From here, right? From here, the muscle is going all the way straight onto the radial side. It is crossing the carpal bones on the radial side and it is inserting here. So this is called extensor. As it is going to the carpal bones, carpi, onto the radial side, radialis. Extensor carpi radialis. इसका टेंडन्स बहुत लंबा है, सो लॉन्गस. ओके, एक्सटेंसर कार्पी रेडियालिस लॉन्गस. When I tell longus, there will be brevis. Extensor carpi radialis brevis. I will write down all of them, don't worry. Next important point. From the extensor point, a muscle is coming like this all the way and attaching to your digits. Extensor digitorum, because it is attaching to the digits. Next, another muscle is coming all the way from the extensor point and attaching to your little finger. Little finger in Latin you call it as digiti minimi. So this muscle is extensor digiti minimi. Extensor digiti minimi. Next important muscle. From the extensor point, it is coming all the way to the ulnar side and going above and inserting here. Extensor carpi ulnaris, because onto the ulnar side it is crossing the carpal bones. Extensor carpi ulnaris. Clear everyone? Let us write down all of them now. Okay. The first muscle, brachium to radius, brachioradialis, brachioradialis. Next, extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, right? We have also discussed extensor carpi ulnaris, and there is one last muscle, there is last muscle that is called as anconius, which is also called as screwing muscle, which is also called as screwing muscle. Sir, अब इसका भी nerve innervations याद करना रखा. See, nerve innervating all your extensor muscles is only one nerve, that is your radial nerve. Radial nerve is the only one nerve that is innervating all your extensor muscles. All your extensor muscles are innervated by radial. Shaukat, love you too, Shaukat. All of them are innervated by radial nerve. So guys, have you understood everything? Right? Regarding the muscles of the hand, regarding the cubital fossa, right? Regarding the spaces of the hand, and finally regarding the brachial plexus and the upper limb arterial supply. Okay, all of this we shall be discussing in the next class, and most probably by next class we shall finish up the upper limb, and then we shall start the lower limb. Okay, we shall start the lower limb. So far whatever I've taught you guys today, so far whatever I've taught you, are you all clear? I just want to know, I just want to know whether are you all clear with all of this, right? I hope the faculty who are teaching you might have discussed all these topics, so this would be a revision for you, so even this would help you like a revision, right? So it might be helping you. So are the explanations, are the notes, everything is clear guys? Next live is tomorrow. Tomorrow will be the physiology class. Okay. Thank you. Thank you so much. Thank you so much. Thank you so much. So guys, whatever group you are in, whatever group you are in, I think you are in some kind of group, right? WhatsApp group. So I want, please put your feedbacks in that group about this class. Okay, so whether you loved it or is there anything that I could change, so everything if you put it in that group, so based upon that I would follow and teach. Okay, so don't forget to write down your review. Definitely write down your review as well as everything that needs to be done. Okay, the class is fine, then write it fine or whatever it is. So guys, thank you so much for your patience. Thank you so much for listening to my class. And I think I'm telling you guys, this will be mostly enough. Whatever I'm teaching will cover all your MCQs. You need not to worry. You need not to have a second thought process of studying another book or material. Okay, this will cover all of them. If you want, once you finish it up, and then you can look at the MCQs, guys. All of them will be covered mostly. Okay. So thank you, guys. Thank you so much. Goodbye and good night.